5, 4, 3, 2, less absorption or low absorption, they needed resuscitation. Born to mothers with complicated pregnancy, labor, or delivery. During the gestational period, the mother had hypertension, hyperthyroidism. Okay, mother had few complications. The babies born to such mothers are also categorized under higher risk infants. Okay, then had clinical problems since delivery and sick but now recovered. They were sick but अभी क्या हो गया? Recovered. That does not mean that they are sick. They can go back to the sick and sick infants. Meaning, a sick infant appears animal with abnormal clinical or vital signs, provided they are previously well or high risk infants with new or abnormal signs reclassified as sick. They might be previously they would have been healthy, normal or at high risk level, but कुछ problems आ गया, they became sick. Disease condition हो सकता है, congenital malformations हो सकता है, infections हो सकता है, something else. Then, okay, you have seen high risk infants. First minute में did they cry? No. They did not cry in the first minute. They cried in the 5th minute. Okay, crying was not absent. Either in the first minute the cry would have been weak. Then 5th minute they cried. Okay, sucking poor but not absent. The sucking reflex is weak but completely absent. Depressed sensorium but is arousable. Sensorium depressed मतलब you can see in the image the baby will be continuously in the sleeping mode, but when you tap them or when you call them they will be aroused. They will open their eyes, they will respond. Respiratory rate of over 60 per minute but no chest retraction. Here we are not talking about heart rates, here we are speaking about respiratory rates. Over 60, more than 60, but chest retractions absent. Chest retractions मतलब when you are breathing, the chest wall goes inside. Okay, that's an abnormality वो यहाँ पे present नहीं है. Jaundice present, but no staining of palms and soil. The body is having jaundice, but the visible signs and symptoms present नहीं है. Visible signs and symptoms मतलब स्टेनिंग होगा राइट इमेज कलर येलो कलर में वहां पे स्टेनिंग नहीं होगा. ठीक है, प्रेजेंस ऑफ एनी वन ऑफ द फॉलोइंग: डायरिया और वोमिटिंग, अम्लीय स्ट्रेनिंग और पस, पस्ट्यूल्स, फीवर. इसमें से कोई भी एक सिम्टम अगर प्रेजेंट है एंड एनी ऑफ दीस प्रीवियस सिम्टम्स यू आर गोइंग टू कंसीडर देम अंडर at risk or high risk category in your next. ठीक है, आपका असेसमेंट हो गया, यू आइडेंटिफाइड दे आर एट हाई रिस्क, देन कुछ इंटरवेंशंस होना चाहिए, राइट? व्हाट विल बी द इंटरवेंशंस आप बताओ. लो बर्थ वेट, हाइपोथर्मिया, लेस क्राइंग, sucking poor but not absent. ठीक है, now correlate with the previous topics which I have demonstrated. What will be your interventions? बताओ. What will you do? What will you do to improve the body rates? Breastfeeding, exclusive breastfeeding, in case needed formula feeding भी provide करोगे. How to increase, how to prevent the risk of hypothermia? Skin to skin contact, KMC, swaddling, radiant warmer, phototherapy in case needed. ठीक है, phototherapy for jaundice in case needed. Sucking poor but not absent. Feeding techniques में alterations लेके आओ. Sucking reflex is poor but completely absent. You can use cutlery spoon feeding, you can use parallel feeding. यहाँ पे techniques change होगा. Then depressed sensorium but arousable. Continuously you have to make the baby aroused, और इसके होगा. In the sleeping, they will stop breathing and they will die. Okay, that's also a problem. Then respiratory rate of over 60 per minute but not just retraction. Either you need to provide oxygenation, ठीक है, CPAP machine, BiPAP machine का continuously SpO2 monitor करना पड़ेगा. not staining, you might have to keep the baby under phototherapy machines or drugs. You might have to start with treatment modalities. Then presence of any one of the following. तो specific therapy आपको provide करना पड़ेगा. जो भी steps हमने यहाँ पे बताया, let's see in the screen. Hospital care में first thing you will provide is warmth. No need to read the entire sentence. You will provide warmth using different techniques. Then stabilization. Most baby only need hypothermia prevention. For occasional apnea, provide physical stimulation. apnea मतलब lack of absence of breathing stop हो गया apnea condition. ठीक है, अगर ऐसा कंडीशन आएगा तो मतलब respiratory distress होने का चांस है. तो continuously in between you have to physically stimulate the baby, rub the back, flick the salt, so that the baby will remain alert and take normal breathing. ठीक है, except the time when the baby is taking nap or sleeping. Then feeding. ठीक है, we are talking about higher risk. Don't get confused. Start with direct breastfeeding. If not sucking well, use express breast milk by spoon or pan. Correlate हो गया. ठीक है. Then specific therapy. I have told you. The baby is having any sort of diarrhea, vomiting, उसका specific treatment आपको करना पड़ेगा. Skin में कुछ pustules है, skin में कुछ infection है, fungal infection आ गया, bacterial infection आ गया, उसके वजह से treatment देना है तो specific drug treatment या specific hospital or home based or clinical based treatment baby को provide करना. Then you have to monitor all these things. यहाँ पे time क्या लिखा है? Every 2 hours. What all things? Body temperature, whether the baby is having any sort of convulsions or not, how the baby is sucking, weak, absent or completely good, normal, then any sort of bleeding from the nose, from the mouth, from the ear or especially from the umbilical cord. Okay? Sensorium, whether the baby is completely alert or the baby is going into a weak or depressed sensorium every now and then. Then diarrhea, respiration, vomiting, apnea, abdominal distension and cyanosis. Abdominal distension पता है ना? The abdomen distends out there or it will bulge outside. You have to monitor all these signs every 2 hours. Okay, then you are going to reevaluate and you are going to convey the problems to the doctors or you are going to educate the parents regarding this one. Then sick units. Okay, now you just have to compare it with higher risk, so it will be very easy. Sick unit मतलब क्या है? Let's see the features. Weight less than 1500 gram. High risk में क्या था? In between 1500 and 2500. यहाँ पे कम हो गया. 15 less than 1500 मतलब in which category they will come? Low birth weight, very low birth weight or extremely very low birth weight category में आएगा. Less than हो गया, क्या नॉर्मल होती less than 1000. अगर less than 1000 है तो extremely low birth category में आ गया. Temperature less than 36 degree despite of warming. You kept the baby under radiant warmer, still the baby's axillary temperature or wall temperature or rectal temperature is not coming up. Cried after 5 minutes of birth. Okay? First minute का आपका story में they did not cry. In the 5th minute they cried. तो first minute में cry नहीं किया मतलब they might have given CPR, they might have given the resuscitation or they might have given the ventilation. Then after 5 minutes they cried. Okay? Absent suction, completely sucking reflex absent. Not arousable. You can see in the image the baby is continuously in the weak mode. The parents will get confused. Okay, the baby is sleeping continuously. That means okay, baby is taking feed, baby is sleeping continuously. That's good. No, the baby is continuously not arousable. That's a danger sign. Okay. Then apnea or gasping respiration. High risk में क्या था? Less than respiratory rate was less than 60. यहाँ पे क्या है? Apnea और gasping respiration और death breathing. Vyasti matlab they are taking a severe heavy breathing, then you can basically see the movements and also hear the sounds produced, abnormal sounds produced. Then central cyanosis, the trunk or the extremities, the head will be pale or blue. Jaundice with staining of palms and soles. Okay, jaundice will be present, palms and sole will be stained. Which color? Yellow color. And they will have episodes of convulsions. Okay? Respiratory rate more than 60 with chest retraction, bleeding is present, any sort of major malformations will be present, presence of any two of the following: diarrhea, vomiting, abdominal distension, umbilicus draining first, multiple skin pustules, fever. I will say that any one of the following. यहाँ पे क्या हो गया? Any two. Not only this, there are different number of examples, but for easy understanding by the help of images, we have already displayed few signs and symptoms. Okay, don't just consider okay only these are the categories by which we will separate or segregate the babies. No. Okay, then यहाँ पे भी आपको ट्रीटमेंट प्रोवाइड करना है, राइट? डोंट लुक एट द स्लाइड. अभी इसका मैनेजमेंट बताओ. सही मैनेजमेंट थोड़ा डिफरेंशिएट होगा, राइट? So it is less than 1500, then it is free time हो सकता है, extremely lower quick, very lower quick हो सकता है, उसका अकॉर्डिंग फीडिंग देना है, अल्टरनेटिव फीडिंग टेक्निक्स आपको इम्प्लीमेंट करना पड़ेगा. सकिंग रिफ्लेक्स कंप्लीटली absent है, मतलब normal breastfeeding is entirely not possible. So either you have to give control spoon, palate feeding or NG tube or OG tube feeding यहाँ पर देना पड़ेगा. Then not arousal मतलब continuously baby को stimulate करना है to become alert and awake. Then apnea or gastric respiration, you have to provide assistance in breathing. ऑक्सीजन प्रोवाइड करना पड़ेगा सैचुरेशन मेंटेन करने के लिए. either you will intubate the baby or will provide any sort of airway access like oropharyngeal airway, nasopharyngeal airway depending on the condition. Then central cyanosis, bluish discoloration prevent करने के लिए या उसको improve करने के लिए you will give ऑक्सीजन एडमिनिस्टर करोगे. jaundice उसका स्पेसिफिक ट्रीटमेंट करोगे. कन्वल्शन एपिसोड है, मतलब कन्वल्शन मतलब कंपेयर इट विद सीशर. ये सीशर एपिसोड आएगा तो उसका स्पेसिफिक मैनेजमेंट आपको करना है. सो यू कैन सी ओवर हियर सेम थिंग, वार्म, स्टेरिलाइजेशन, फीड एंड स्पेसिफिक थेरेपी. डोंट गेट कंफ्यूज्ड विद द ड्रग एंड एवरीथिंग, दैट इज जस्ट गिवन फॉर एग्जांपल. इसका डिटेल वर्जन आपको मिल जाएगा. मेनली यू हैव टू फोकस ऑन वार्म, हाउ टू स्टेरिलाइज द बेबी, ठीक है. देन फीड डिपेंडिंग ऑन द कंडीशन, फीडिंग टेक्निक चेंज करना पड़ेगा. एंड आल्सो स्पेसिफिक कुछ इंफेक्शन या डिसीज कंडीशन है उसको मेडिसिन के थ्रू या ट्रीटमेंट मोडालिटीज को चेंज करके या मतलब कुछ इंप्रूव करके वहां पे भी आप स्पेसिफिक इंटरवेंशंस करना पड़ेगा. एंड यू हैव टू मॉनिटर द प्रीवियस सेम थिंग्स, बट चेंज कहां पे आ गया? All the things are same: temperature, convulsion, sucking, diarrhea, sensorium, but heavily ugly. ठीक है, कंपेयर करो. In the wards, vital signs are taken in कितना घंटे के इंटरवल में रहता है? वार्ड मेन वार्ड, फीमेल वार्ड, जनरल वार्ड
8 hours.
1 hour.
Duty.
If you take the vitals at 8 o'clock in the morning, next vitals का टाइमिंग क्या कब है? 4 hourly. ठीक है, और 2 hourly और average normally you know 4 hourly होता है. So take at 8 o'clock, you will take the next vitals at 12 o'clock, or 2 hourly है तो you will take at 8, 10, 12 to 10. But in ICU कैसे? Continuously मतलब every hour. Why this done? Compare करो. कुछ correlate कर सकते क्या? In the wards, the vitals were assessed but in ICU setup it is taken every hour. Why? Critical disease. They are sick. Okay, consider them as sick infants, and the patients admitted in the ward as at risk infants. ठीक है, वार्ड में किसी का कार्डियक अरेस्ट हो गया या हार्ट अटैक हो गया तो उसको वार्ड से रखोगे, they will be shifted to the ICU, cardiac ICU, or जो भी सेटअप है hospital, they will be shifted. So the time interval between the assessment is staged. Immediately they can become sick, immediately they can have some complications. So every hourly, at least every hourly आपको ये पूरा साइंस मॉनिटर करना है, say temperature, conversion, suckling, bleeding, etc. and communication. If you find such complications, explain the baby's condition and relation with parents. You are not going to hide it from the parents, right? Calm and quietly, according to the scenario, you have to explain it. Okay? The baby is having sorts of complications. We have shifted the baby to NICU. वहाँ पर हम वो प्रोवाइड करेंगे. In case कुछ reassurance के लिए कुछ साइन करना है तो proper terms and conditions और according to policy आप follow करोगे. Discuss the need for referral if the baby needs more advanced care. तो particular hospital में neonatal resuscitation करने के लिए neonatal ICU setup नहीं है. So we will be asking them to refer the baby or shift the baby to a higher or advanced level hospitals and organize for transportation. Simply लेके जा सकते हैं बेबी को, अगर नॉर्मल पेशेंट है तो भी they need a proper setup for transportation, an ambulance with ICU or NICU setup. इसका पूरा setup आपको देखना पड़ेगा. You should have everything in your head. ठीक है, the baby is serious, you are going to transfer the baby. Okay, baby को गया, ठीक है, वहाँ पे हॉस्पिटल आपको लेके जाना है. You disconnected everything, you are giving the handover to the parents. ऐसा करते हैं? No. You should keep in mind. Okay, the baby should be transported with all the necessities, oxygen, ठीक है, and mobile ICU setup. उसका एक proper box होता है, the baby is being transported. इंडिया में होता है, I don't know, only major hospitals, but outside India, for example in New Zealand, the baby is fully taken out of the hospital or out of the NICU in such a regulated chamber. ये chamber के अंदर क्या होता है? warmth provide करेगा, they will get enough oxygen, ठीक है, उसका ट्यूबिंग ऊपर IV से या infusion pump से proper medication connected है तो ये पूरा इसके अंदर उसका setup होता है. So they will be transported in such a setup. Clear? Any particular doubt in care of sick neonates? ठीक है, care of sick neonate में आपका कुछ intervention part नहीं है, but क्या part रहेगा? Assessment part. So and so हो रहा है, तो they are categorized. These things are not there, so they are separately categorized. Assessment is very important. If you know the normal, then you can understand the abnormal. Normal pulse आपको पता है, so then you will palpate. अच्छा कि अभी 100 हो रहा है. My pulse is 70, 60 to 100. बेबी का पल्स में 60 to 100 है, it is normal. ऐसा कंसीडर करोगे? Vital parameters, body का parameters, ठीक है, blood count के parameters, पूरा चीज का ध्यान आपको होना चाहिए. ठीक है? We will continue with the next stereotopic and practical sessions tomorrow. Tomorrow we will be having the session of IMNCI, then how to primarily assess the baby, primary and secondary assessment, then pediatric life support, which includes infant and child CPR. Okay, don't get confused. Now today you have practiced newborn resuscitation. The ratio is different. Okay, a few techniques will be similar, but tomorrow you are going to learn about child and infant CPR. If possible, take a look at the parameters, क्या है, कुछ recent change आ गया क्या, kindly refer and come, so it will be easy for you to coordinate that. Okay, if I am saying 1.5 inch में depth करना है, तो if you have a previous idea, तो आपको easy. So try to just read it, okay, regarding child and infant CPR, then come for tomorrow. ठीक है? I hope